So the fact that it's more diffuse and not any particular fingers indicates to me a hypothesis. So RMTs don't diagnose because we don't have x-ray vision. We can't tell you accurately what is happening, but we can hypothesize based on our education and what clues are being given by our patient. The fact that it's more diffuse and you feel it in your joints and in general in the limb says to me that it's a restriction of blood flow as opposed to a nerve that's actually being pinched.
That's what I feel as well.
Yeah. So let's get in there and see where your poor blood vessels are being. And you can tell a little bit. Can you put both your hands together? I don't know if the viewers can tell or if you guys can tell. There is a lot more pinkness in general in this hand. If I pinch, the blood comes back really quickly. And this one, there is a bit of a bluish
I do see that
hue, right? And if I push the blood out, it does.
Feels different.
Look at that. Look, it takes a while for that blood flow. Do you see that, Kiki?
I do
you
see
get
that.
it?
It's really clear.
So, to me, look how fast that's recovering as opposed to this guy. And this hand is colder too, and that matters. So, in general, I would say, Darren, you do have a circulatory issue, which most women do. Low on iron, a whole bunch of reasons why that is. But I would also say it's definitely a blood flow issue, which definitely would be restricted up here. Sounds good? So, a couple of rules. This is the spiel. I know you signed a consent form. Doesn't mean that I get to do whatever the fuck I want and say that you signed a consent form. By my college, by the College of Physicians and the CMTO, which is my governing body, you can change your mind at any time.
That is how consent works in all scenarios. Everyone on the internet, that is how consent works.
Yes. Once given, it can be withdrawn. I do anything that bothers you. I do anything that hurts you. I do anything you change your mind about. Please do not hesitate to tell me. Massage is a team sport, okay? Just because your massage therapist knows doesn't mean they know what's best for you. And so it has to be a dialogue. Okay? Your pain should never exceed a 7 out of 10. Yes, we want it to be challenging. Yes, we want to know that we're actually enacting actual change and that it's not just a rubby, make nice, expensive moisturization session. However, if we are not working in alignment with your parasympathetic nervous system, if you don't get that animalistic sort of where we hear your tummy gurgle and where your breathing sort of slows down, that is actually a very important part of a massage treatment. That's your rest and digest and heal parasympathetic nervous system kicking in, not your like, ow, oh my god, her elbow hurts me so bad, like fight or flight system. As we said before, rule number 2 of massage therapy is they're Clark Kent and Superman. You can't have both happening at the same time. So if your sympathetic nervous system is on, your adrenaline cortisol is up, oh my god, Loki, you cannot join us. That means that you're not healing and we're not getting the benefits of the immune system going. And everything I do works with your blood flow, with your immune system, working with your body, not against your body. Does that make sense?
And I would say, like, for me, my entire body, a pain level of 7 is good, but for my shoulder, I would say 6. That's where I would cut it off.
Oh, I'm definitely,
because, like,
so how I like to work, even though I'm very strong, and I do specialize is the wrong word, I do a lot of deep tissue, and that's what I'm known for. You wouldn't start right away with deep tissue. We escalate up until you say, that's deep enough, and then we stop. At that level. Sound good?
That sounds good.
You're not allergic to mint or clove or eucalyptus?
I'm not.
Because I'm going to use some hot towels. You like heat?
I do.
As well? Oh, excellent. So, for the treatment today, my plan is to work on your back, upper body. So, we're going to do low back as well. We're going to work on the thoracic system. We're going to work on, and if you don't understand the parts I'm talking about, tell me. We have a chart that I can show you on. We're going to work on the lats. We're going to go into your armpit, which is super unpleasant, but I'll try to make it, it's very effective to liberate any weirdness that is happening in the joint.
Yeah, the lymph, there's a big lymph node in there, right?
Huge lymph node, and also things tend to get sticky and trapped in there. And so what sucks about getting in there is we're peeling it off the bone, so your shoulder instantly like releases and you have instant relief in the shoulder, but to get there it is a bit of a pokey, yucky, unpleasant sensation.
Okay.
But we'll work together.
Yeah.
And if, again, nothing has to be done. Nothing is mandatory in a massage, ever. Sound good? Do you have any questions for me? You can ask questions at any time. Any choices I make treating you are supposed to be justifiable medically. Is that clear?
Yeah, I'm cool with this.
We're gonna give Darren some privacy to get on the table. Today you don't have to take the pants off, but because they're jeans, I do recommend.
Okay.
Okay, we're gonna keep you toasty and warm. We're gonna use hot towels. Does that sound okay?
I love it.
May I use rosemary in your hair at the end as just like a little treat?
Yeah. My hair is dirty right now.
Love it.
Okay, great.
Perfect. Okay, let's do this. Okay, Kiki, cut. So while my patient, aka Darren, for this one, is changing and getting between the covers on the table, I am sanitizing my arms to up above the elbow because I do require all my arms and my elbows to be involved in the treatment. Also, my own personal trick is I like to support internally rotated shoulders by putting towels underneath them to push the shoulders back a little bit. I find that it makes deep tissue on the shoulders a little less painful. It also neurologically trains the brain to sort of understand where the shoulder is supposed to sit in correct posture. So every time someone is in here, at least for an hour and a half, their shoulders are, without them having to work at it, where they're supposed to sort of hang out. That's the idea behind it. How you doing, Derek?
Pretty good.